Hi, this is Yaz Dabul, live from SCAI 2019, and I'm pleased to be joined by Dr. Raj Swaminathan. Dr. Swaminathan, thank you so much for joining us.
Thank you.
So you basically we're here to talk a little bit about the PAD toolkit.
That's right.
Tell us a little bit more about the unmet need here. Why do we even need a PAD toolkit? And tell us a little bit more what the PAD toolkit is.
Sure. I mean, so peripheral arterial disease is woefully underdiagnosed. There's over 10 million people in the country that have the disease. And I think the unmet need really is that a lot of patients have this, but they can be asymptomatic or they can have atypical symptoms. And a lot of providers are not actively searching for it or doing the right kind of screening test. And it is accompanied by a lot of morbidity and mortality. And so that's the reason we're trying to sort of increase the awareness around PAD. So we created this toolkit, which is more of a resource center on the SCAI website. It's a series of about 5 educational modules that we've posted online. And we had a lot of participation. About 10 faculty from SCAI helped to put this together. And the 5 modules cover a lot of topic. The first module is just a sort of PAD 101, just an overview of what it is, what the scope of the problem is, what the unmet need is. The second module focuses on how to diagnose it, what the screening criteria are. Third and fourth modules go into more therapies, so medical therapy and then interventional therapies. And then finally we talk about care coordination. A lot of these patients need help not just from the cardiologist but also vascular specialists and rehab and so on and so forth, primary care providers. So we talk about that collaboration a little bit.
And the resource center, how is that funded? Who basically keeps updating it?
Yeah, so it's a good question. We started this about a year and a half ago. We initially got funding from industry, and SCAI had put a lot of resources into it as well. And I think that's just sort of a testament to SCAI leadership's commitment to making PAD one of its key sort of quality improvement areas and clinical care areas. And so around the first year when we got the funding, we were just working on putting all the modules together. And then maintenance is very important. So in the past 6 months, we've gone back over these talks, made some updates, and mostly added webcasting to it. So we put some voice to it, so when members go online, they can actually hear us sort of do some commentary and talk about the topics. We're hoping to go to a third phase where we'll continue to make some updates in the next year or so, and hopefully make it feel a little bit more real and add some case-based scenarios to it, make it a little bit more patient-centered. Our long-term hope is that people will use these modules in their own practice, that members can take some slides off of these and use it when they do cath conferences or their own talks here at SCAI or local talks to their primary care docs, and in that way sort of increase awareness about the disease.
And so far, how many members have joined, and what's the feedback been so far?
That's a good question. It's available online. So right now I don't have any tracking about how many members have actually gone on there to take a look at it. But we know it's been increasing in popularity just by people asking for more information about it. And hopefully we'll transform to social media and tweet a lot more about this and get that information out. And then we'll have some analytics on it.
So next step, are there going to be more modules, more involvement about basically additional diseases, not just PAD? What's the next step?
Yeah, that's a good point. I mean, we focus this set on lower extremity peripheral arterial disease. So at some point we can expand that to talk about carotid disease and renal artery disease and other sort of peripheral arterial disease as well. But even within lower extremity disease, there's a lot of new things that are coming up, new controversies, new issues, new data. And so it's going to require a lot of constant attention to keep updating this. But I think we're going to stick to the modules that we have, but make sort of refinements in it and grow it like that.
Thank you so much for the update.
Thank you. Thank you for the time.
And thank you all for joining us live from SCAI 2019.